In this demonstration, we're going to run through a couple of options for treating the hamstrings. So again, we're going to get our anchor on the tape by wrapping around once, and whether applying to yourself or applying to a patient, as with any technique, we really want to take our time in applying these. One of the main things that we see with this done wrong is rushing the technique or trying to go too quick with it and not applying it properly, ensuring even coverage throughout. So one of the main things we want to do once we have that tape secured in place, and again, we can use two bands of tape here, one slightly lower and one slightly higher, or one straight after the other, depending on the size of the patient. And then we'll begin to work actively or passively, if you're a treating therapist, through full knee flexion and extension. From there, once we progress, once symptoms subside, we can add in more of an active role by getting the patient or ourselves up, supported with a wall or with a rack like we have here, and again working through flexion of the knee and extension of the hip. Once we are comfortable to do so, we can then work into a squatting position as well. Here we're just going to use the rack for a little bit more support, and dropping down as low as we can, as low as we feel comfortable to in the squat, and we can even pulse in the bottom of that squat once or twice just to add to that flossing technique.